Hello, and welcome to Conversations on Europe Teachable Moments. This is a program brought to you by the European Studies Center at the University of Pittsburgh. My name is Jae-Jae Spoon, and I'm a professor of political science and director of the center. Today, I'm here with Dr. Jessica Pickett, who is the co-founder of Tomorrow Global, a boutique advisory firm dedicated to reducing health disparities worldwide. Dr. Pickett holds a PhD in health economics from the University of Pennsylvania. She's also a center associate at Pitt's Global Studies Center. Today, we're going to be talking about the response to the COVID-19 pandemic in Europe. Welcome, Jessica, and thank you for joining us.
Thank you so much for having me, JJ. It's a pleasure to be here. So the virus, the exact pathways from that SARS-CoV-2, the virus that causes COVID-19, took from China through to the rest of the world isn't entirely known, but given how transmissible it is, it spread most places very quickly. And we're still finding out early evidence that it had arrived both in the US earlier than people had thought, as well as in Europe. But because the virus is prone to particularly large outbreaks some of the time and not others, so some potential outbreaks fizzle out and others really take off, we can get some idea of that it was going kind of through Iran, through Italy, through Spain, very, very early on. Those were after Wuhan itself, the city in China where we first discovered the virus. Italy was hit, if not necessarily the only or the next place where it actually went. Again, we don't necessarily know the entire trajectory. It took off there and it was hit incredibly hard. A lot of hospitals were overwhelmed, and the country entirely shut down. And what we're seeing though is that that the course of this virus, because it can be kept under control when you have strict lockdowns. Italy, even though it was hit hardest early on, is actually doing, because it's been so strict, it's kept the virus from resurging as much as other parts of Europe that were hit later, but have not imposed quite as strict control measures and are now seeing much higher caseloads. And I do want to emphasize actually early on, as you mentioned, I'm a health economist, and a lot of people have been talking about the trade-offs, whether in the US or in Europe, between public health outcomes and economic outcomes. And I just actually want to kind of take the moment to emphasize that what we see in Italy and elsewhere in Europe, these comparisons drive home the point that there really isn't a trade-off. You don't really have an economy if you don't have people who are healthy. Mm-hmm. And so, as much as there are indirect health effects from lockdowns, what we're seeing in Italy is that they're in much better shape now economically as well. One of the countries that was staked out a position kind of apart from the norm has been Sweden. So I think a lot of people have heard about Sweden. Mm-hmm. And very early on, they staked out the belief that if you believe that infections will confer durable immunity, and that people trust their government and will, even if they're going to be exposed themselves, they won't put other people at risk, then Sweden thought that you could have what some people call the herd immunity strategy, where you can protect the economy, leave things open, just keep people who are elderly or other immunocompromised or otherwise at risk, kind of separate from the rest of society. And you might have a lot of illness early on, but then in the long term you'll be protected. Where in contrast to countries who are trying to flatten the curve, which would just postpone those. Sweden believed would just postpone those illnesses and deaths. It was a very high-risk gamble that didn't pay off, and they've had some of the highest death rates, the highest death rates in Europe as a result. But they also stalled the economy, because if you looked at data on how much are people moving around, there's a lot of cell phone data, you can track, mobility. It was still about, I think, it dropped by, I want to say 70% in that ballpark of what you saw in neighboring countries. So it was still, the economy still, contracted severely. So far, it looks like they've had more deaths, just as much drop in economic growth, and really no additional protection. The UK, they have the National Health Service, it's the NHS, and that has played a huge role, of course, in providing care and treatment, but it also creates very different incentives than the more privatized healthcare systems we see in the US. At the same time, it's very vulnerable right now because of Brexit. So just as the NHS has been struggling with shortages in its workforce anyway, because many of its employees, many have to leave as a result of Brexit, many EU nationals, others have visa exemptions, but it's complicated, of course, many other aspects of their life, so are electing to leave. So you're seeing shortages being exacerbated right when we need healthcare systems to be staffed up most. So that's kind of one example of how you see the politics of a country and the dynamics of its health system play out through a pandemic lens. Germany is a country that has a phenomenal healthcare system, phenomenal public health system. They have among the highest per capita investment in public health measures, separate from medical treatment of any country of comparable income. And that's alongside having a government that is deeply invested in science in a way that we're not seeing as much in the US or even the UK. But it's also very decentralized. It's been considered a huge success story. They've rolled out testing very widely, incredible contact tracing. They've kept the disease largely contained relative to its neighbors in Europe. But partly because they had been so rigorous about it, you're seeing waning support for those measures, much as you were seeing in patients here. And that started to fray at the subnational level. Compared to the US, almost every European country has been more able and willing to provide households and small businesses with financial support to weather the lockdowns. The lockdowns were always meant to be temporary. While you can get the virus under control, you can scale up contact tracing and test production. This was not envisioned as a long-term solution. But that said, one of the challenges in the US is that because we don't have the same level of social safety protections, even relatively short lockdowns have been devastating for families, because if you can't afford to eat, that's also a public health problem. And many countries have been in particular looking at variations on universal basic income or guaranteed income to ensure that everyone has the money they need. So in the US, there was those stimulus payments, a one-time check of up to $1,200 per person. That's a fraction of the size and frequency that you're seeing in most other countries. Similarly, there are a lot of initiatives that would pay companies to keep people on their payrolls. It would allow small businesses greater flexibility. Some of these have the potential to be permanent, and Spain in particular, which was one of the countries that was hit hard early on, and so has had to have some severe lockdowns. A big proportion of their economy is tourism, which obviously has taken a large hit. And so they've rolled out a guaranteed income and guaranteed payment to households below a certain income threshold that they're already indicated will be a permanent policy change that can protect against future pandemics or other shocks. But also in Spain and in pretty much every other European country, even those people who are still struggling, who've lost their jobs or are otherwise suffering from the consequences of lockdowns, they all at least still have access to healthcare. And that's a really important point to make, is that the financial implications of illness are much harsher here, where so many people have their medical insurance tied to their employment. So to kind of bring this back to the matter at hand, to speak to the classroom, as it were, until we have all of the tools we need, the scientific knowledge, the vaccines, the financial policies in place, what happens with students? In the US, we're seeing that because community transmission is so high, many schools are finding themselves starting the academic year online. Most European countries are also beginning the year with closures. The majority of those are decided at local levels. Several are national closures. The only countries in Western Europe that are remaining fully open for the beginning of the year are Austria, France, and Norway. And again, all of those also have substantially lower levels of community transmission right now. But that said, we may be able to learn from their experience.
Thank you very much for joining us, Jessica, and sharing your expertise on this timely topic. If you're interested in other teachable moments, please visit our webpage. We will also have additional resources to accompany this discussion.